I'm so pleased to introduce our lunch speaker, and I want to thank her for being here about, I don't even want to say 10 years ago because it goes in such a flash, but when I first began reading Sally's writings and getting to know her, I had the great pleasure of actually meeting her and out here in California and following her throughout the years. And then not that long ago, I had a wonderful Sunday night where I turned the TV on, and there she was talking with Mark Levin. And I really thought that was just incredible. And so I want to thank you for that. So we're really so pleased that she's here. Sally is the president and CEO of the Pacific Research Institute. And she is the Thomas W. Smith Fellow in Healthcare Policy there. It's a San Francisco-based think tank founded in 1979. Prior to becoming president at PRA in 1991, she was assistant director of the Fraser Institute in Vancouver, Canada. In April 2018, she received an honorary PhD from Pepperdine University School of Public Health for her work on healthcare reform. She writes a bi-weekly healthcare column for Forbes and a weekly column for Fox News. President Trump shared her August 11th Fox News column on Facebook. And if only he'd tweeted it right. In 2018, she had over 300 healthcare-related op-eds published. Quite a feat. C-SPAN covered her Medicare for All panel at the Heritage Foundation, and her interview on Life, Liberty, and Levin was seen by 1.5 million viewers on just that first showing. As a healthcare expert, Ms. Pipes participates in many debates, and most recently, she debated two doctors who support single-payer health care at University of Southern California's Keck School of Medicine in front of 300 medical students. Wow. In addition to her upcoming book that Encounter Books will release in January 2020 called False Premise, False Promise, The Disastrous Reality of Medicare for All, other books by Ms. Pipes include The False Promise of Single-Payer Health Care, The Way Out of Obamacare, and The Cure for Obamacare. Her book, The Pipes Plan, The Top 10 Ways to Dismantle and Replace Obamacare, was released in January of 2012, and Art Laffer wrote the foreword, and it was endorsed by Steve Forbes. So she has quite a resume, and we're so pleased that she's here to talk to us today. So thank you so much, Sally, for coming.
Well, thank you so much, Chris, and also Jeremy, for inviting me here today. Please continue to enjoy your lunch. As a policy analyst, I'm used to talking while no one's listening. So please continue to enjoy your dessert, which I just said to my seatmate that Michelle Obama would probably say that shouldn't be on the menu. I want to say at the outset that understanding healthcare is similar to unraveling an onion. Many layers and many tearful moments, and I don't need to tell all of you that. With a very few exceptions, Bernie Sanders, Senator Elizabeth Warren, many politicians, regardless of their political party, do not want to talk about healthcare. They find it just too complicated, and so they wish it would go away. I believe that President Obama, with his Affordable Care Act, which became law on March 23rd, 2010, it's 9.5 years old, he really wanted a single-payer health care, and he saw this as a stepping stone, because before he became president, he was a fan of single-payer. Then he wasn't. He said the Affordable Care Act, many people like their private coverage, so he was against single-payer. But then, since he's been out of office, he's been a supporter, again, of single-payer. When President Obama was campaigning in late 2009 and early 2010, he promised that the average family would see their health care premium costs go down by $2,500. Well, we all know that that was a lie. And also his other promise, if you like your doctor and you like your insurance plan, nothing will change. So these are lies that have proved to be lies, as I say. Nancy Pelosi, the Democratic Speaker of the House, in 2010 said 2 weeks before the passage of the Affordable Care Act, she made that brilliant statement, we have to pass this law so that we can find out what's in it. Well, the American people have found out what is in it, and it means high premiums, high deductibles, a shortage of doctors, and a small network of doctors that they can get in to see, and also a small choice of insurance plans. Even former President Bill Clinton, who I guess is in a bit of a scuffle with Hillary Clinton right now over the Epstein affair, said, it probably caused a little bit of another rift in the household. He said, just before the election, Obamacare is the craziest thing in the world. I'm sure Hillary was not that pleased. As we know, the Republicans took the presidency, the Senate, and the House in the 2016 election. And I think a lot of that had to do with the fact that candidate Trump said that we will repeal and replace Obamacare. And so that was a big statement, and he made that statement in Pennsylvania. And I think it really was a turning point in his campaign in the election. So today, there is a huge push for single-payer health care, and I'm going to talk a lot about that. The Democratic Socialists of America, Alexandria Ocasio-Cortez, AOC, is a huge fan of that, and it's very frightening for me, and it should be very frightening for you as doctors. I do believe healthcare reform is going to continue to be and will be the most important domestic policy issue in this upcoming 2020 election. So all of these Democratic candidates, 19 Democrats are seeking the presidential nomination, and they're all for either single payer or a stepping stone approach to single payer, such as a public option, Medicare for all, Medicare for America, a Medicare buy-in program, etc. But we have to remember, Obamacare is still the law of the land. What is its future? I think it's on very shaky ground right now after the individual mandate ended on January 1st of this year. The court in Texas ruled that the whole law was illegal because of the ending of the individual mandate. We're now expecting, after the Fifth Circuit Court of Appeals case, we're expecting a decision in December of this year. And so it's going to be very interesting to see how that goes. President Trump is in support of the case, but the Department of Justice is not. So we'll see how this sort of comes about. Under President Trump, there have been a number of executive orders that have tried to open up the healthcare market. These include the short-term limited duration plans for individuals who are between insurance plans or young people who are invincible and will not probably have to use health care. Then there are the association health plans, which would allow small groups to band together and have a larger group, a larger risk pool, which would help to reduce the costs. But Democrats, of course, say that these are all junk issues and they're designed to sabotage Obamacare. The third important part of the executive orders was President Trump's expansion of health reimbursement accounts, and I think that is another really terrific thing that has happened. But the Democrats have been filing lawsuits trying to end these things that would actually open up the market in healthcare rather than closing it down into a single payer system. On June 16th on ABC News, President Trump said the administration is going to unveil something terrific, a terrific healthcare plan. He argued something is needed because Obamacare is a disaster. But nothing had happened. So then in August, last month, he said, we're going to be releasing a phenomenal healthcare plan. And we're going to release it in September. So the GOP will become party of great healthcare. So we shall see. I know from Brian Blais, who was working in the White House or in the National Economic Policy Council, they're talking about expanding health savings accounts, putting a lot of money into high-risk pools in the state so those people with pre-existing conditions can get coverage. So a lot of interesting things. Will it happen or not? I don't know. I know Senator Mitch McConnell is very nervous about this. He said, well, let's wait and see. But I think a lot of the Republicans don't want the Republicans or the administration to release a replacement plan. I think that they should release a plan. People need to have something to run on, not just negativity. Because Obamacare overturned the whole American healthcare system for a small number of enrollees, somewhere at a max 12 million, and now today about 10.8 million. And of course, the reason that there are so few signups is because of the high premiums, the high deductibles, and the limited number of networks that people found that were available to them. So it was really too bad. 86% of those 10.7 million people who are on the exchanges receive subsidies from the federal government. But we've seen a reduction in the uninsured rate has gone up because a number of the people that were on the exchanges decided the premiums were too high, so they didn't renew their coverage. So with the exception of a few more moderate Democrats, such as Speaker Nancy Pelosi, I can't believe that in this whole thing that I'm calling her a moderate, but you know, you've got to deal with what you have to deal with. On March 12th, she said in an interview with Rolling Stone magazine on Medicare for All, she said, oh, $30 trillion, how are we going to pay for all of that? You know, even she realizes, she's been in government too long, but she realizes that these programs are very expensive and you can only get them through if you increase taxes. There are 19 candidates seeking the Democratic nomination. You probably saw today that de Blasio dropped out. I don't know if this was because, yeah, exactly. But you know, did he drop out because the comedian Billy Crystal said yesterday, drop out of the race and start taking care of the mess in your city of New York? So maybe that caused him to drop out, but he's got a lot going on. As I said, Medicare for All, or stepping stone approaches to Medicare for All, the public option, a government insurance plan that would compete against private insurers and the exchanges, Medicare for America, Medicaid buy-in, Medicare buy-in, all of these things are what all of these candidates really want to end up with, a single payer system. The debates, of course, were the first two debates. There were two debate nights. The key people, of course, were Senator Bernie Sanders. I don't know if you saw on The View that Joy Behar said Bernie Sanders looked like he just jumped out of a garbage can on the September 13th debate. But there were 4 people in that first debate that were backing Medicare for All: Sanders, Warren, Kamala Harris, the senator from California, and of course de Blasio. But after a few criticisms, Kamala Harris said, oh, well, I didn't really understand the question about whether I supported single payer or not, so she's now sort of has another plan, sort of a stepping stone approach to Medicare for All. The second debates in Detroit, July 30th and 31st, and the third, as I just mentioned, it was held in Houston. Healthcare was obviously the most important issue in those debates. It took up the bulk of the debating program, which really surprised me, because 5 years ago, 6 years ago, healthcare would hardly be mentioned in a debate. But it's very front and center right now. Of course, Bernie Sanders and Senator Elizabeth Warren are the two that are really pushing single payer. But interestingly, Senator Warren will not answer the question, how are you going to pay for it? And then she was on Stephen Colbert the other night, and he kept saying, well, how are you going to pay for it? Are you going to increase taxes on the middle class? And she said, well, the middle class will see their taxes go down because we're going to tax the wealthy, and we're going to tax financial institutions. Well, we all know the wealthy is not such a large group. And so while she says middle class costs will go down, she will not come out and say middle class taxes are going to have to go up. She keeps interrupting people and saying, now here's the thing, now here's the thing, but she won't say, what is the thing that's behind you? It was interesting when she was doing a debate in Des Moines, Iowa. Now, it was in Des Moines when the CNN interviewed her a few months ago, and she said also she supported single-payer health care, and she had the insurance company, let's eliminate all that, let's get rid of that. And then there was a backlash on that. So she said, well, I don't know. I think one of the reasons she's plummeting in the polls is because of all of her flip-flopping on health care. She was back in Ohio recently, and a 91-year-old woman in a nursing home, when Kamala was spouting on about her health care plan, she looked at Kamala and said, "Just leave our health care alone." Kamala was completely dumbfounded. She didn't know how to respond. But as I say, I think one of the reasons she's not doing well is because she's flip-flopping. I know deep down she is definitely a fan of single-payer health care. And of course, remember Harry Reid, the former Senate Majority Leader? He got into the game just the other day when he said he's not happy with some of the presidential candidates pushing Medicare for all. He said, it's going to be a real problem. How are we going to get that passed? I think that we should focus on improving Obamacare, which is not the right solution either. But at least Pelosi and Harry Reid, the old guard of the Democratic Party, realized Medicare for all would be a very difficult thing. So let's see. I think it's interesting also, I don't know how many of you belong to the American Medical Association, but the man in the street believes that the AMA covers every single doctor. They don't know about apps or docs for patient care. They think every single patient, every single doctor is part of the AMA. But at their meeting in Chicago on June 12th, their annual meeting, for the first time, the vote was 53% against Medicare for all and 47% to build on Obamacare. But it's interesting, this is the highest, we've had the highest percentage of people in the AMA supporting single payer. So I think it's interesting. The makeup of the AMA is different. There's now a number of professional societies of specialists, and a lot of young women in medicine are sort of part of the AMA and supporting these ideas, but these other association societies are, leaving the AMA and supporting opening up the healthcare system. I think it's very important to define single payer. I know most of you probably know, but single payer means there will be a single payer, and that will be the government. All private coverage would be banned. My nickname for Bernie Sanders is the Pied Piper of single payer. And so he has had in 2016, when he was running against Hillary, he really brought single payer into the limelight. And then, of course, 2017, he released his first single-payer bill, and then in 2019, this year, he released his second single-payer bill, which is even more comprehensive than his 2017 bill. It would be introduced within 4 years. And then his friend, House member Pramila Jayapal from Washington State, one of the winners I noticed was a medical student at the University of Washington. Pramila Jayapal, she has 118 sponsors for her single-payer Medicare for all bill. Bernie has 14 co-sponsors for his bill. But as you know, Jayapal isn't in the presidential race, but Bernie is. I think Democrats in Congress and at the state level, there's a lot of push for a single payer. Many people say, well, that can't happen in the United States. Well, I'm sorry, it can happen. And I think that is why people like myself and many of you have to get out there and explain what Medicare for all will mean for doctors and for patients. Nelson Griswold, an employee benefit advisor, gave the keynote address earlier this year at the Next Gen Growth Leadership Summit in Nashville. I'm not in the Next Gen now, I'm past all of that. But he said, single payer may be closer than you think. This is a fight that we don't want to lose. Once a country adopts a single-payer healthcare system, it has never gone back. And look at Canada, the country where I'm from. He says, my prediction is we will have single-payer healthcare in this country within 5 years. So very, very frightening. So today, single-payer is more popular than it has ever been in this country. The Kaiser Family Foundation poll showed in July that 51% of Americans polled support single payer. It's down from 56% in April, so maybe we're making an impact. I hope so. But the thing is that when you ask those same people, do you support tax increases to support a government takeover of healthcare? That support drops to 37%. It also drops to 37% when people are said, well, you will no longer be able to have your employer-sponsored coverage. That will be eliminated. Support also dropped down to 37%. 180 million Americans have their coverage through their employer, which of course was a mistake of the government back during World War II when wage and price controls were in. But 70% of those of people with employer-sponsored insurance polled like their coverage or they find it absolutely excellent. In spite of the fact that Elizabeth Warren and Bernie Sanders in that debate on September 13th said, "We've never met anyone who likes their insurance." Well, I mean, I'm sure it's very difficult for you as doctors doing all the paperwork and that, but I have employer-sponsored coverage and an HSA, and so far, I've enjoyed it. So they forgot to ask me what I thought, but maybe she'll be in touch with me later. So as I say, it was a hot issue in 2016 and 2017 and in 2019, and now it's a big part of the campaign. We've got Warren, and of Bernie's 14 co-sponsors, 4 of them are in the race. Sanders, Warren, Booker, Harris, and then Gillibrand and de Blasio were in the race, but they have both dropped out. So Bernie Sanders has said he wants citizen co-sponsors for his legislation to show that the public is really ready to fight harder for single-payer health care. This is a struggle whose time has come, he says. His bill, his 2019 bill, and what he says on the campaign trail is there will be no copays, there will be no deductibles, there will be no premiums, there will be no referrals to specialists. Everybody is going to sing Kumbaya, and they're going to have the very best health care in the world. And we'll also add 11 million illegals. They should be able to be part of the single-payer health care. I don't know whether 11 million is the number. It's probably low. But all of the people in the debate said they supported giving health care to illegals because health care is a human right, regardless of your citizenship. Bernie Sanders finally came out and gave a cost estimate of his plan, because before, in 2016 and 2017, it took Charles Blehaus from Mercatus Center to say that the plan would cost between $30 and $40 trillion over 10 years. Finally, Bernie came out a couple of weeks ago and said, yes, my single payer will cost between $30 and $40 trillion over 10 years. It will include a new 4% income tax on those earning more than $29,000 a year, a new 7.5% payroll tax, and a new marginal tax rate on high-income earners, and a new tax yet to be determined on large financial institutions. So we'll see how this all comes to play, but I know that people, when they hear, as I said in the polling, that they'd have to pay much higher taxes, they wouldn't support it. Bernie, of course, came under criticism from John Delaney and Joe Biden, talking about how everybody will be in the plan. Well, Delaney quickly pointed out in Michigan that union members love their health care plans, and they're not going to be so excited. So to have to lose that and be in single payer. So a couple of weeks ago, Bernie came out with his workplace democracy plan so that union members could then, if they have Medicare for all and their employer doesn't have to pay the cost of their health care, so therefore they should be getting more in benefits. So each union contract could go to the National Labor Relations Board, have their contract opened up, and then they will get more money. NLRB has more work than they can deal with now, but the thought of every union having their contract open up is just absolutely ridiculous. But Charles Blehaus, who I just mentioned, said he's just increased his forecast for the cost of Medicare for all up to $38 trillion over 10 years. He said if you double all of the income taxes, personal income taxes, and corporate taxes, it wouldn't be enough to pay for this plan. So he also said that when people think something is free, they will demand a lot more of it. And what does that mean? There will be a shortage of doctors because under Bernie's plan and Pramila Jayapal's plan, one of the ways to cut costs is to cut your wages. So all docs would be paid at Medicare rates, which are 40% below what you get paid for treating private patients. So I believe that a number of doctors will retire early from medicine, they'll go into other professions, And the scariest thing is I believe the best and brightest of young people in this country who've always gone to medical school are no longer going to go to medical school. The American Association of Medical Colleges just came out saying there would be a shortage in this country of 122,000 docs by 2032, and that's even before Medicare for all. But Bernie Sanders says, when health care is free, it's going to be fantastic. But as I say, there will be long waits for care, ration care, and a shortage of doctors, which is, what we see in countries like Canada and the UK. As I mentioned, Kamala Harris she's had some setbacks in her campaign, but we also have Joe Biden, who is out there trying to be Mr. Reasonable. I don't think, my prediction is that he will not be the Democratic candidate, but he is out there fighting. He said, I don't want Medicare for all, I want to build on Obamacare. But again, he is pushing the public option, a government insurance plan that would compete against private insurers in the exchanges. We all know that the government will price their plan cheaper and therefore crowd out private insurance. So it's just a slow go, stepping stone approach to Medicare for all. I mentioned Elizabeth Warren and her inability to say how she would pay for her plan, but she gets a lot of media coverage. So I'm looking forward to writing some op-eds on her. Here's the thing, and see what the thing really is. Stephen Colbert the other night said Medicare for all was her most radical position. So she is very radical along with Bernie. What a team. Maybe we could have a Warren Sanders vice president team. I think Mr. Trump would even have an easy time defeating that ticket. And then, of course, the South Bend, Indiana mayor, Mr. Buttigieg, he's also seeking that Democratic nomination. And he just came out yesterday with his plan, Medicare for all who want it. And of course, he's supporting a public option, and he thinks, well, people will still be able to keep their private plan, but as I said, public option will crowd out private insurance. He says his plan will only cost $1.5 trillion over a decade compared to the 30 to 40 trillion over a decade. But he says if the public option isn't working and it's just not a good idea, I then support Medicare for all. So basically, he supports a single payer system. He also wants to increase those subsidies to people who are eligible for subsidies on Obamacare, which anyone earning up to 400% of the federal poverty level is eligible for a subsidy. So he probably wants to go up, like in California, they went up to 600%. So he didn't say what it would be, but he wants to increase subsidies. So the public alternative, he said, could lead to Medicare for all. So Mr. Buttigieg, I don't know how he's going to fare in this in the race, but I don't think he will be the candidate or the vice presidential candidate. Pramila Jayapal, as I mentioned, her plan would be introduced over 2 years instead of Bernie's 4 years, and she did come out and say a couple of weeks ago, 1 million jobs in the insurance industry would be lost. And I just had to renew my driver's license, and I had to get this ID card, so I had to book an appointment with the DMV. I kept, trying to get online and book my appointment with the DMV. They would never give me a time that I could go, so I went to the Glendale one, and they said, yes, we can get you an appointment on November 16th. But my driver's license was expiring today. So anyway, we all know how inefficient the DMV is, and the post office, and even the post office has competition. So with 1 million people losing their jobs in the insurance industry, it frightens me to think what a government takeover of paying you as docs and settling claims with patients. It's absolutely a frightening thought. Seth Moulton, who has been in the race, Democrat from Massachusetts, he is a veteran of the military, and he said, I'm not a socialist, I'm a Democrat. I want to make that clear. I think I'm the only candidate here who gets single-payer health care because I have a single-payer plan through the Veterans Administration. And I'll tell you, it's not perfect. All you have to do is read the paper, listen to the media every day, and you'll find out that the VA is a disaster for our vets and the military. I was debating Uwe Reinhardt at an international conference a few years ago, and I was talking about Canadian single payer and Britain and things, and he interrupted me and said, "Sally, we have a single payer program in this country, and it works extremely well." I said, "Well, Uwe, what is that?" He said, "The VA." This is before all of the nightmares have been coming out about the VA. Unfortunately, Uwe passed away earlier this year, but I don't know before he passed away if he realized what a disaster the VA has been. At the state level, there's a lot of states that are pushing for single payer. Washington State and Colorado have governors have just signed bills for public options in those states. California, Governor Newsom never pushed forward with his promise of single-payer health care after it had been parked back in the previous administration under Jerry Brown. But we have some other exciting things. We have a state individual mandate. We're covering illegal immigrants up to the age of 26 now. And so there's all kinds of exciting things going on in California which are detrimental to all of us, but he hasn't pushed single-payer. And I don't know why Bernie Sanders doesn't talk about the fact that the state of Vermont, Governor Shumlin, a Democratic governor, signed the bill for single payer back in 2011. In December of 2014, he had to rescind that bill because he said the people of Vermont cannot afford a single payer healthcare system. But Bernie never talks about the fact that even on a microcosm level, it wouldn't work. So I've talked about the single payer ideas that are out there now that are, in the mainstream, but they're hypothetical. So I thought I would spend a few minutes talking about two countries that have universal coverage programs. One is Great Britain under the National Health Service, which turned 71 years old on July 5th. It has been burdened with terrible financial catastrophes since it came into being, and patients have got worse and worse access to health care. And Canada, where I'm from, one of 3 countries in the world that has a true single-payer healthcare system. The other 2 are Cuba and North Korea. So Canada fully took over its healthcare system. It started in 1947 under that greatest Canadian, Tommy Douglas, in the 40s. He started it in Saskatchewan. The government full takeover was in 1984. The single-payer system in that country, the Medicare system, says that there can be no private coverage for anything considered medically necessary. So the only things that aren't medically necessary are things like LASIK surgery, cosmetic surgery. But basically, that's about it. This greatest Canadian, this came up in the debate by Dr. Adam Gaffney, who heads up Physicians for National Healthcare the other night. He said, "Well, Tommy Douglas, the greatest Canadian." I responded, I said, "Yes, named by the Canadian Broadcasting Corporation, the government-owned TV and radio network." So anyway, we've had this system for fully since 1984. Every doctor works for himself, but they can only get paid by their provincial government. So, my cousin, I was mentioning at lunch, who's a corneal transplant specialist, cataract surgeon in Vancouver, his global budget that the province sets up for him is usually done in late November, so he can't do any more surgeries because he can't get paid. So Canada has one of the most expensive single-payer systems in the developed world. And you remember, Bernie keeps saying single-payer will be free, even though he's admitted this $30 to $40 trillion cost. He says Canada has free health care and everyone has access. Well, first of all, the average Canadian family pays $13,311 a year in hidden taxes for a healthcare system that provides ration care and long waiting lists for care. The average wait in Canada last year from seeing a primary care doctor to getting treatment by a specialist, 19.8 weeks. Back in 1993, it was only 9.3 weeks. And so there are 1 million Canadians on a waiting list waiting to get care out of a population of about 37 million. The dollar amount of lost wages for people who are waiting for treatment that can't work is $2.1 billion. So that's all important information that people need to understand under a single payer system. There are a lot of empty operating rooms across Canada, but there's a huge waiting list for people needing orthopedic surgeries. My niece, who graduated 4 years ago as an orthopedic surgeon, neither she nor any of her friends could get jobs as orthopedic surgeons. The reason being, they could set up a practice, but the provincial government in the province they were going to set up in had no money to pay them, so they couldn't get jobs. Meanwhile, all these people need shoulder surgeries, knee surgeries, and hip surgeries, and many go to the US or go abroad. SecondStreet.org just showed that 323,000 Canadians left Canada for the United States and other countries because they deemed those waiting lists were too long in respect to their health. Michael Bublé, the Canadian crooner from Vancouver, where I'm from, I love his Christmas album. I can't wait to start my Christmas musical playing. His son, Noah, at age 3, was diagnosed in Vancouver with liver cancer. Michael Bublé did not stick around in Vancouver to get treatment for his son. He went to Children's Hospital in Los Angeles, where he said, "We had the very best docs, he got the very best care, and today my son is cancer-free." This is, Canadians have an alternative. They can go to the United States and pay out of pocket. My own mother died from colon cancer because as a senior, she couldn't get a colonoscopy. She got an X-ray, which doesn't show that you have colon cancer, because there were too many younger people on that waiting list waiting for a colonoscopy. When she was hemorrhaging in late November, she finally got her colonoscopy at Vancouver General Hospital. She died 2 weeks later from metastasized colon cancer. You can, if you're older, for Americans who would be on Medicare, their care will be rationed because the system will have to take care of younger people first, but there will be long waiting lists for care. So if you look at the UK, as I said, their system came into being in 71 years ago, and so it's just over 71 years old. The NHS is under incredible strain. In June, 4 million Brits were on a waiting list waiting to get treatment. They missed, in January 2019, it marked 5 years since the first 62-day cancer target was missed, with more than 127,000 left waiting too long to get vital treatment for their cancer. The World Health Organization study was highlighted in Lancet Oncology just the other day, showing that Great Britain is at the bottom of the list of an international survey of countries on 5 out of 7 of the top cancers. In terms of ovarian cancer, they were the 3rd worst, and esophageal cancer, the 2nd worst. This is what will happen if we get Medicare for all. These results are just astounding. People come from all over the world to get treatment. Remember that Rolling Stone frontman, Mick Jagger, when he was diagnosed, and he's a Brit, diagnosed with needing a heart valve replacement, he went to New York Presbyterian. He didn't rush back to the UK, where he probably would have got treatment because there is a private alternative in the UK. But his younger brother said, "Thank goodness Mick did not got to wait in line for the NHS." So, you know, Mick Jagger knows, and he has an economics degree from the London School of Economics. So these are the kinds of things: long waiting lists, ration care, lack of access to the latest technology, the latest innovative drugs. All of these things are going to be outcomes of the single-payer system if we get this system in the United States. So we have to spend our time educating people on these facts because it will be a disaster. It can't become the law today because the Republicans control the presidency and the Senate. But if they lose both of those and the Democrats keep the House, this is going to be either, depending on who the president is, a big issue. But if it's not the big issue, there will be these stepping stone approaches to Medicare for all. And as the late, great Charles Krauthammer said, before he passed away, he said, "I expect the US will have single-payer health care within 7 years." So let's I believe that if we get single payer in this country, the United States will be on the road to serfdom. And as Neil Griswold said, once you get it, there's no off-ramp. It'll be impossible to get off the single payer bandwagon. We will have it forever. So I hope that you've enjoyed this talk, that you will read my books on single payer and talk. You should put them out in your waiting room so that people can see what it really means. We need to get the best healthcare system. We need to build on the system we have. Universal choice will lead to universal coverage. We all want affordable, accessible, quality care for everyone. A government takeover is not the answer. As my friend P.J. O'Rourke said, if you think healthcare is expensive now, just wait until it's free. Thank you very much.